Our group members are Hanieh, Nieli, myself, Paige, and Shanna. We're looking forward to walking through this Canva presentation regarding lasers for periodontal therapy. So the first question that comes to my mind, I think of right away laser, laser tag, laser this, but lasers in dentistry are quite different and quite useful. So a laser in dentistry, it provides a single concentrated wavelength of light. It's absorbed by a single target of tissues, either soft or hard. It converts the light into heat or a photomechanical effect, and it also helps embellish and control the control environment for the tooth structure.
How are lasers used in dentistry? So for periodontal therapy, pocket decontaminations, calculus removal, tissue reshaping, soft tissue surgery such as gingivectomy, frenectomy, crown lengthening, and gingivoplasty, hard tissue applications for the cavity preparations, bone recontouring, and calculus removal, on endodontics for the canal disinfections and pulp capping. They also use for the whitening and pain and healing. They use the low level of the lasers. As you can see in the picture, there are different types of lasers, erbium lasers, diode, ND, and CO2.
Next, we have the lasers. Diode lasers are becoming very popular in dentistry because they're compact, relatively affordable, and operate in the near and frame range, usually between 805 or 1064 nanometers. Unlike some other dental lasers, diodes are designed for soft tissue only since the energy is absorbed by pigments like hemoglobin and melanin. One unique thing about diode lasers is that they don't directly cut tissue with the light itself. Instead, the fiber tip is first initiated or coated by lightly burning articulating paper. This creates a hot tip that cuts tissue by heat transfer. Because of this, diode lasers function a bit differently than other types of lasers. In dentistry, diode lasers are widely used for soft tissue procedures like gingivectomies, biopsies, and frenectomies. They also are helpful in periodontal therapy because of their bactericidal effects. Beyond surgery, diode lasers are sometimes used to enhance tooth whitening procedures and for photobiomodulation, which helps with pain relief and healing. ND-YAG lasers were the first pulse lasers designed specifically for dentistry back in 1990. They use a 1064 nanometer wavelength, which is the near infrared spectrum. This wavelength is absorbed by pigments like hemoglobin and melanin, which makes them especially effective for targeting pigmented tissue. They work mainly through photothermal effects, which means the energy turns into heat and penetrates deeper into tissue. In practice, NDA lasers are used most often in periodontal therapy, where they can debride and disinfect periodontal pockets and encourage fibrin formation. That fibrin helps seal the pockets and supports reattachment of tissues. The ability to form clots also makes these lasers useful after extraction to control bleeding and promote bone healing.
Now we have erbium lasers. So they're pretty versatile lasers. They're used on both hard and soft tissues. There are two main types, each with slightly different wavelengths to target different tissues. In soft tissue, their main effect is photothermal, while in hard tissue, they work through photodisruption, which actually breaks apart the bone. For hard tissue, erbium lasers are efficient for tooth preparation, bone resection, and caries removal, often without the need for local anesthesia. They remove the smear layer, disinfect dentin and enamel, and allow atraumatic bone cutting. For soft tissue, they can be used like a scalpel for gingivectomy, frenectomy, biopsies, and gingival contouring, as well as root surface decontamination during periodontal therapy, all with minimal post operative pain. They're also used in implant surgery, so they could safely decontaminate implants affected by periimplantitis, reshape bone during implant site preparation, and manage soft tissues around implants. And they're also safe to use on titanium with the correct settings. The next type of laser is the CO2 laser. So they've actually been used in medicine since the 1970s and in dentistry for over 25 years. The traditional soft tissue CO2 laser operates at 10,600 nanometers and is highly absorbed by water, making it excellent for precise cutting and hemostasis. Soft tissue procedures include gingivectomy, frenectomy, biopsies, and pre prosthetic work. Because the laser seals nerve endings and blood vessels, sutures are rarely needed, and patients experience less pain and swelling after surgery. It's also quite effective for ablation of leukoplakia and dysplasia.
So benefits of laser use, they reduce pain and anxiety. They're quiet, vibrations-free treatment, less bleeding and swelling, and faster healing and tissue regenerations. There are precisions and control, effective bacterial decontaminations, and versatility, reduce the complications, lower risk of infections, and reduce needs for anesthesia and seizure.
Now we have a video explaining one of the uses of periodontal therapy with animation.
As dental laser technology has advanced, so has our ability to treat periodontal disease with the laser. Wavelength Optimized Periodontal Therapy, or WPT, is a breakthrough, minimally invasive periodontal disease treatment protocol developed by Dr. Robert Barr during 20 years of pioneering laser dentistry. WPT makes optimum use of dentistry's best two wavelengths, erbium YAG and ND YAG. WPT may be used for moderate to severe periodontal disease treatment. After completing a gross debridement of the treatment area, the ND YAG laser is used to remove the diseased epithelial lining to within 1 millimeter of the bottom of the pocket. While the diseased epithelial lining is being removed, the ND YAG laser energy also accomplishes biostimulation, which has been shown to increase the body's healing response by 6 times. Removal of the diseased epithelial lining with ND YAG laser energy also serves to create room for insertion of the erbium YAG laser tip into the pocket to assist in the next step, calculus removal. Next, we insert a specialized erbium YAG handpiece tip with water spray into the pocket to remove calculus at subablative laser energy. The special tip utilizes photon-induced photoacoustic streaming, or PIPS, to remove the calculus and disrupt the destructive biofilm on the root surface. With the laser firing, the tip is lowered along the root surface towards the bottom of the pocket until you feel a piece of calculus on the root surface. The erbium YAG laser energy allows you to just tap it off. Not only does this step remove calculus, it also decontaminates the root surface and removes the endotoxins that will otherwise interfere with proper healing. The erbium YAG laser selectively removes the calculus without damaging the underlying cementum, as shown in this histology of the root surface after lasing. Now we go back over the root surface very lightly with a piezo scaler, using a side-to-side motion from the top to the bottom of the pocket just to confirm all the calculus is removed. Thorough removal of the calculus is crucial to good healing results. Next, we use an endodontic explorer to confirm tactily that all the calculus has been removed. If any calculus is remaining, the erbium YAG laser is used to remove it. The erbium YAG laser is then used to dissect the periodontal attachment from the bottom of the pocket to the bone. This is necessary to stimulate the regenerative factors from the bone that will help with healing in the periodontal defect. An endodontic explorer is used to confirm that all soft tissue has been removed from the bone, so we get great regenerative factors coming from the bone. Next, the endodontic explorer is used to slightly perforate the cortical bone to get good angiogenesis and release the regenerative factors from the bone. Without a great blood supply, our clot cannot mature. Then, we again introduce ND YAG laser energy in the pocket to start development of the clot. We insert the tip all the way to the bottom of the pocket, then we fire the laser and draw out the tip until we see the blood start to get slightly darker. At this point, we stop lasing and start placing the collagen plug. Collagen inherently promotes homeostasis. In contact with blood, collagen is known to cause aggregation of platelets, which bind in large numbers to the collagen fibers. The aggregation platelets degranulate, releasing collagen factors that, together with plasma factors, enable the formation of the fibrin clot. The sponge structure of the absorbable collagen wound dressing provides a three-dimensional matrix for additional strengthening of the blood clot. Stabilization of the clot is mandatory for proper healing. This is where other competitive periodontal disease treatment protocols fall short. With the collagen matrix, we achieve a firm, stabilized clot. Finally, light-cured barricade or paracryl is used to protect the clot and allow it to mature. Wavelength optimized periodontal therapy, a breakthrough in minimally invasive periodontal disease treatment that can restore your patient's periodontal health.
And these are our references. Thank you for watching our presentation.